New phone. I was like, what?
I had no idea.
No, I didn't. Can I clear this vegetation fire notification?
Yeah, you can. Yeah, but
Okay. Is that like an app with your work? Is that how you get notified
no,
calls?
that's watch duty.
Watch duty? Oh, okay.
It tells me when there's brush fires. It's nice because we find out before a lot of times.
That you need to post up in Oceanside because the pier's burning down?
Yeah.
Hey, we're probably gonna need to go cover. I was wondering they were sending you guys on that one.
Vegetation. Oh, the pier.
Yeah, because you guys are right north of it.
If we had a fireboat, they probably would have.
Pendleton doesn't have a fireboat? Aren't you guys like on part of your? Yeah, your part of your base touches the beach.
And we have a harbor.
Doesn't the military have a fireboat? One of those things that goes in the water. Remember we saw them on the beach?
Yeah, those aren't fireboats though. They don't shoot water.
Oh.
It's the fireboat that shoots water. That's what they were getting.
Oh well, Pendleton won't send military aircraft for what the heck? For fighting fires. So. Okay.
Hello, can everyone hear me?
Okay. And we're finally recording.
Hello?
Hello.
Okay, everyone can hear me, right?
Yes.
Okay, sorry about the delay. I have a new computer here, so I was just trying to set it up for the first time. All right, guys, so your last quiz, okay? So this is going to cover, well, it's going to cover, like, I do have some heart rhythms on there. It's nothing that you have to read and interpret, but it will, like all the other ones, it'll give you the rhythm, and then you have to identify what intervention you're going to need to do, okay? But primarily it's going to focus on shock and then like emergency care, what we learned last week, okay?
Okay, we're actually charging.
So first of all, you have to understand what triage is, okay? So what happens during triage? What is the purpose of triage?
Okay. We're in the cabinet.
Yeah.
Yeah. Are you talking about triage, like when the patient comes in and you're gonna first assess them?
Correct. So why do we triage patients?
Get a brief history and know why they're coming in to the hospital?
Okay, so what is the purpose of having a triage there? Why don't we just like admit them straight into the hospital, straight into like the unit?
Because on some of the reasons they're coming in for don't really require that, so you could kind of just see them really quickly in the triage area, and then they could maybe get a
Exactly.
prescription and go.
So the main reason is prioritizing care. Okay, so what level of care do they need? Do they need to be seen right away, or can they be like put to the side for a little while, and we can deal with more pressing matters? Okay, so it's basically prioritizing who needs care first and foremost. Okay, especially if you have patients coming in with various emergencies, some may need more care than others. Okay, so your question on this quiz is going to be, you have basically a mass casualty incident, okay? Now with a mass casualty incident and you're triaging patients, there are those that may not need that much in terms of intervention, so you could push them over to put them to the side temporarily. But what happens if there's someone that is so sick that is like ill, um, doing the interventions will take up so much resources and so much time and like so much resources that could be put to another patient. Do you think we would prioritize them as first and foremost to treat?
No.
No. Okay. So like if they're unconscious, okay, they have no respirations even after the like EMS in the field has already tried repositioning their airway. basically we're just going to move on to the next patient, even though they may still have a pulse. Okay, this patient, they may require more services and more resources than what is available or what is required or what is available at the time, especially when you're dealing with a mass casualty incident. When dealing with a mass casualty incident, you're looking at which ones you can treat first and foremost, and basically like with your limited resources, doing the most care, providing the most care for the most number of patients. So you don't want to put all the care, all your resources on one patient. Okay. Does everybody understand that? Okay. All right. So next we have prioritizing care. Okay. So when we're prioritizing care, like for deep lacerations, okay, what is the first thing we're going to be doing? If a patient comes in with like a deep laceration that is like hemorrhaging, what is the first thing you're going to do?
Control the bleeding.
And how are you going to control the bleeding?
And apply pressure or a tourniquet or stuff it with gauze.
Very good. So you're going to apply pressure. Okay. Apply pressure to try to minimize or stop the bleeding. You can also, like you said, put a tourniquet on the patient. Okay. In terms of anaphylaxis, what do you think is going to be priority?
Airway.
Epinephrine.
So it's going to be airway, okay? And of course, with the air, we're going to like probably one of the meds we're going to give first and foremost is epinephrine. You're correct, but airway is probably the number one priority. So you're going to assess for wheezing, okay? So you want to do your assessment first, okay? And if the patient, yes, they probably need epinephrine, which can help the patient, but if they're already swollen and they're like having respiratory compromise because of the swelling, we're going to probably want to do our assessment first and like identify if we need to intubate this patient right away. Okay, because we don't know how long it may take for the swelling to go down. So you don't want the swelling to get any worse. So you want to do your assessment first and identify, does this patient, can they maintain their own airway, or is there's too much swelling? We need to intubate this patient right away. Okay. Okay, what about a patient with a motor vehicle accident who comes in stems post motor vehicle accident? What do you think would be a priority intervention for this patient?
Would that be like when they put the collar on them? Make sure there's no, in case there's like a spinal injury or something?
Very good. So you're looking for any like spinal cord damage, spinal cord trauma, right? So you don't want to really mobilize the patient. If you're in a car accident or you come up to a car accident scene and you get out to assist and there's a patient there's somebody in the car, but they're complaining they have like pain in their back or they can't feel their legs, you don't want to move them. Okay. As long as the scene is safe, you want to keep them there until you can stabilize their spinal cord.
She gives me a little crummies.
Okay. What about snake bite? What can we do what is our priority for a snake bite?
Anti-venom.
Very good. You want to get the anti-venom because some of it can act pretty quickly. And a lot of hospitals probably don't carry all the anti-venom. So you need to identify what you need beforehand. So if you need to request it from another hospital and get that transported over to you or get the patient over there, we can get that going. Okay, because time is a factor when it comes to like venom. So you need to get the anti-venom. Okay. Okay. Of course, you're going to put like a elastic bandage to act like a tourniquet or above this and below the site to isolate it so it's not flowing through, but you need to get the anti-venom. Okay. Okay, so what does EMTALA mean? So EMTALA is the Emergency Treatment and Labor Act. So what does it mean by EMTALA in the emergency room?
That everybody has a right to treatment and you can't turn someone away.
Of course. Okay. So if we get, I don't know, if you're working at Parfum and you get a patient who is a Kaiser member, they have no insurance with like Blue Shield or through Parkview, you still have to treat them. If you get a homeless patient with no insurance, you still have to treat them and discharge them. In some cases, like with the homeless patients, Kaiser actually, like a couple years ago, they got dinged for putting a bunch of like homeless on the buses and sending them up north. So now with Kaiser, there's like a whole protocol that we have to do, and they have to meet with a social worker, and they have to try to find them like a place to go to once they're discharged. Okay, so it's important to initiate social worker referral, especially at Kaiser after that lawsuit that they got. Okay, so you can't turn anybody away. So understand the difference between primary and secondary survey. Okay, so I believe this is one. Yes, it's a select all that apply questions. So it's asking the nurse should plan basically a plan of care based on the primary survey, which includes which of the following. So you need to understand what primary survey is and identify which of those findings that the nurse assessed are deemed part of the primary assessment. Okay. All right, so you have 2 rhythm questions on your exam. Okay. So ventricular tachycardia. Okay. So if a patient has ventricular tachycardia, what is the first thing you want to do?
Check for a pulse.
You want to check for a pulse, right? Because if they don't have a pulse, then you can do CPR. However, if they do have a pulse with ventricular tachycardia, what can we do for a patient with a pulse?
Cardioversion?
Okay, very good. Cardioversion. What else can we do? What about like assessment wise? What can we do? So a lot of times you might call the doctors.
Check the
What?
check the lead.
Close. So a lot of times they might say VTAC on the monitor, the patient's stable, he's alert oriented, so that you might call the doctor and they'll say get a 12 lead EKG. Okay, so get a 12 lead to confirm. So that would be one of the interventions. If the patient's stable enough, we would get a 12 lead and just confirm. And if you're thinking ahead before you call the doctor, you might even go ahead and do that 12 lead EKG before you call the doctor. Say it's already been done. Here's what the finding says. Okay, so 12 lead EKG, and then we can also prepare for cardioversion. Okay. What about monitoring? What are we going to monitor for? Someone who has ventricular tachycardia. So once we cardiovert them and they convert back, what are we going to continue to monitor?
Their heart rate?
Okay, so their heart rhythm. So we'll, of course, continue to monitor their rhythm. But say the patient was in VTAC, okay, we needed to cardioverse, so we went ahead and cardioverted him, so he's converted back. But we still need to find out what caused the ventricular tachycardia, right? So one of the things we would do is assessing the electrolytes, the labs, which of course includes your potassium. So you'd continue to monitor the serum potassium level. Okay.
I don't know, Tony didn't tell me why. Or anything that he knew, or
Okay.
anything like that.
So a couple weeks ago when we went over shock, okay, so there are a lot of manifestations that are included with shock. Typically, you'll see the patient's tachycardic, you'll see the patient's hypotensive, okay, tachycardia because it's trying to compensate for the low blood pressure. But what would be one of the first indications of shock?
Infusion?
Was it fever?
No, it's not fever. What is the earliest like the earliest sign that the patient is possibly going to a state of shock?
Tachycardia?
Tachypnea, very good. So it's tachypnea, okay? Increase in their respiratory rate. So that is one of the earliest findings. And remember, there are various stages with shock, okay? Including like starting off, you have like your compensatory stage where you're not going to really see a lot of like a lot of signs and symptoms, mainly because the body is like is everything stabilized, the body is compensating for the deficiency. Okay, so for a little while, it might work. Okay, but eventually those compensatory mechanisms will begin to fail, and that's where it will progress into further stages of shock. Okay, so let's see.
Oh, okay.
Make sure you understand like the compensatory stage of shock. Okay, there's one question that's going to ask about that. Okay. And again, with compensatory stage, you're not going to see anything like severe symptoms of shock. Okay. It's going to be probably normal or barely noticeable. What about neurogenic shock? Okay. What causes neurogenic shock? So you have a patient, I mean, you're a nurse providing care for a group of patients in the emergency room. Which of the following clients is at risk for developing neurogenic shock? Okay. So your choices are A, the patient who has Guillain-Barré syndrome, B, the patient who has a severe burn injury, C, the patient who is experiencing an asthma attack, or D, the patient who has chronic kidney disease. Very good, Denise says A. Okay, A is the only one that deals with neurological. Okay, so Guillain-Barré syndrome. So that has a potential to cause neurogenic shock. Okay, B and C, those would probably be more. B would be more along the lines of like maybe hypovolemic shock. C would be, of course, anaphylactic shock. Okay, so A, neurogenic shock. Okay, everyone. Does anybody have any questions for me? This is a pretty short quiz. This is only 13 questions, so it's not too long. Okay. Does anybody have any questions? All right. Well, reach out to me if you have any questions. This is pretty much it. I will probably go over a brief review with you on Tuesday, but once we take our exam, we pretty much have nothing else really to do. So we're probably going to have a quick like review activity going over everything in preparation for the final. Okay. All right, guys. Thank you.
Thank you.
All right. Have a good one. Bye-bye.
Bye.
Oh, he's not looking up. He answered the door, but. No.
Cool kid. It's kind of like Vinny.
I guess we're taking kind of like boxing lessons.
Yeah.
With the thumbs up. Yeah, helping with the self-confidence. I mean, apparently it's a kick-ass workout.
Oh yeah, awesome.
Yeah. Like, really awesome for Tony.
Yeah, he needs to focus on his sport though. He's actually really good at his sport.
Don't you think that something like that though would be helpful for him for like being aggressive?
Possible.
You know, people moving.
My little Beastmaster.
Mm-hmm.
My little Beastmaster.
Yeah.
He's got practice on Wednesday and Friday. But it's all right here at that park.
Business. What is it you're working on, sir, you know?
I am not. That's the start of my 10 days off.
I see, okay. That's so nice. That's awesome.
I just got tartar sauce on Clarence too.
Oh, you inspired. I guess the painter, when he quoted her painting for the whole house,
Yeah.
when he said 4, she thought 4,000. It was actually $4 a square foot.
Oh.
Can we do about 8,000?
Oh.
Probably doesn't know yet.
Oh no. $4 a square foot?
Yeah, no, that's what she said. She's like, what the fuck?
That's what she said.
That's ridiculous.
Yeah.
Should've got Doug.
She thought she would have been too. Nino! Not us.
Fish tacos, bro.
Okay.
Oh.
You really, dude? You asked for fish tacos.
But it's too.
It's
Dude,
totally doable for you. So the noise is coming from that room again.
yeah. Wow. Something?
He's extra. Wow, a whole lot of extra that one.
It's good, y'all need some water, okay? Or is there a river in here? Yeah, buddy. How's it? Yes,
Just wait
thank
for you.
you.
I'm like, okay, I gotta do a test one first, just to see how it goes.
You're good. Oh, I know, what you're doing.
I know. I could work at Long John Silver's now. Hey, Katie.
Just make sure everything's recording.
What the heck? Oh my god! Did it drop off already? Oh my god. Your charger like never stays in, or what is this? Is it all done? Well, I mean, it was only